Hello everyone, it's Dr. Arie Benchetrit, and today we're going to talk about facial injections. So injections are probably the most popular procedure done in aesthetic medicine. Even in our own practice, which is a plastic surgery practice, we do way more injections than we do surgery. And the reason is simple. Injections are fairly non-invasive, there's very little downtime, sometimes none at all. They're easy, they're instantaneous, and patients really like the subtle but visible effects that a good series of injections can do. And patients tend to come back for repeat injections, especially if they're very happy with their first experience. So there are basically two types of injections. There's what we call the toxins, which include Botox and Dysport, and there's the fillers. And the fillers, there's a whole bunch of different ones, including Juvederm, Restylane, Radiesse, Teocial, etc. So what's the difference between them? A lot of patients are confused between where they should have Botox and where they should have fillers. So it's quite easy. The toxins, or Botox and Dysport, basically block muscle. So we inject them not in the wrinkle, but we inject them into the muscle that causes the wrinkles. And the most common areas are here between the brow, what we call the glabella, for the frown muscles that cause that, what we call the 11 sign, the two little vertical lines. We often use them for the crow's feet, so when you smile you don't see the crow's feet pronounced as much. And forehead lines are very popular. We could also do some really interesting things with Botox and Dysport, including a brow lift. It's one of the most popular things we do. Patients whose brows come down a little bit and they want a little bit of a brow elevation, but they don't want a surgical brow lift. We can inject a little bit of Botox just here in the corner of the brow, and it actually will move the brow up in a very nice controlled fashion. And if you happen to have asymmetry in your brow, it's very easy with Botox or Dysport to correct that asymmetry. So those are the most common uses of what we call the toxins. The fillers, including again, Restylane and Juvederm, are completely different. These add volume. So we use them to plump, essentially. And they can be used to plump up the lips, of course, but they can also be used to plump up wrinkles that are concave. They can be used to plump up cheeks, the chin, the jawline, and other parts of the face. And they can also be used for structuring. So for example, if you have a little bit of laxity or looseness in the skin and you want a little bit of a lift, then there are some key points on the face where we can use a filler to actually lift the skin. It's not going to lift as much as a facelift or surgery, of course, but it does create a nice lifting effect. So if you're with an experienced injector, the first thing they're going to do is analyze your face first in person. In our clinic, we also use the Vectra, which is this very fancy camera system where we can take a picture of the face, rotate the face in various ways, and actually using different contouring tools show you what the effects of the filler or the Botox will do on your face. You can have a little bit of a preview of what to expect. And it also allows us to do a skin analysis. For example, if we want to see how much sun damage there is on the face, then we can use our skin analysis tool to show us where all the brown spots are. So this actually highlights where all the sun damage is, so we can treat that as well. So the Vectra is a very helpful tool, but the most helpful tool is our own eyes, our own clinical judgment, and the ability to listen to our patients, understand what they're looking for, and then proposing a treatment plan that's going to get them to that result with the most safe approach and the most predictable approach, usually using a combination of Botox, fillers, sometimes other procedures that we offer. So that's a very brief outline of what we can do in the non-surgical realm for the face. In future talks, I'll be talking more specifically about some of these products and actually doing some live demonstrations. So thank you very much.